giving back to
Dr.
them.
Patel, you spoke about what individuals should do. You also wanted to speak before we end about what society as a collective, as a population should be doing. So how should people as a collective be trying to deal with this pandemic's mental health aspects?
Thanks, Rahul. That's something which is, I think, very important, because we're not going to be able to deal with this one person by another. You know, this is a 1.4 billion people affected. And as Amit has said, in fact, the whole world has been affected to some degree or the other. We have to look at statewide, population-wide responses. And let's just first of all acknowledge that each of us, our mental health relies on certain foundations. One of them is certainty about what the future holds. Another is knowing that other people stand with you. And the third is trust in people in authority. And I think each of these offers us ways of thinking about how the state can respond to the population-wide mental health difficulties that we're experiencing. Of course, the pandemic and the state response has disrupted all of these at the moment. Even things we took for granted, like just having a simple meeting with your friends, or that you could rely on the government to be prepared to ensure that oxygen was supplied, are no longer certain. So let me just suggest a few key things that I believe the state should do immediately. The first is it must work towards rebuilding trust in our country. And to do so, it has to be transparent with the facts. It has to communicate, no matter if those facts are difficult. But the more that there is a dissonance in our country about facts, the more the trust harm, the deficit grows, and the worse is the mental health impact. Secondly, I think there is no agency better than the government to coordinate efforts in the community. There are thousands, if not hundreds and thousands, of civil society organizations and individuals who are doing incredible work. They need support, they need financing, they need coordination. The government should not see this as an enemy or as some kind of alternative sector. We must stand together, shoulder to shoulder, civil society, critics, and the state. This is not the time for political and partisan differences. And finally, I believe that we must plan for high-risk groups. We've heard about some. Let us not please forget those who've survived COVID, particularly those who've had acute complications. We know that they will have much higher mental health needs in the weeks and months ahead. And equally, let us not forget those who've been bereaved because someone in their families have died due to COVID.
You know, we've had a very insightful conversation. There are no perfect, clean, clear answers here, but there's a lot to take away from this chat, and there's a lot to reflect on. And I think the key takeaway from my perspective is don't close your mind to the idea that you won't have a mental health issue, because no matter how strong you think you are, no matter how much you think you're in control, this is a situation where no one is truly in control. So, you know, be more aware of how you're feeling, talk, and listen to these doctors and the advice that they've given you. And hopefully, together and individually, we will live to fight another day. Dr. Patel, Dr. Sen, Dr. Parikh, and Bhavna Barmi for joining me on this broadcast. Thank you.